Greetings. In this video, we will know how to take a urine sample. Urine sample is often needed to rule out infection in the urine. Collection of urine sample is extremely important because the technique and the way the urine sample is collected has a bearing on the results. If the sample is not collected properly, then the results may be false. So why do we collect urine samples? So usually we collect two urine samples. One is for a microscopy in which we examine the urine under great magnification to see whether there is any pus in the urine or there is any bacteria. And the second test that we do is a culture in which this urine is plated on certain media and we allow the growth of bacteria. And once we do that, after a couple of days, we are able to identify the bacteria and also identify the antibiotics that will be effective in treatment of this bacteria. So this activity of collection of urine and subjecting it to routine and culture is done for diagnosis of urinary infections. The most important precaution while collecting the urine sample is to ensure that there is no entry of bacteria from any other source except the urine into the vial. So how do we achieve it? So there are two terms that are used while collecting the urine. One is a midstream sample and second one is a clean cat sample. So the midstream sample means that once the child starts passing urine, the initial part of the urine is discarded and the urine which is in the middle, that is after discarding the initial part, is collected directly into the container. So once we do that, what happens is that during the initial part of passing urine, the urine flushes the bacteria which is present around the opening of the urine. And the second thing important is to take a clean cat sample. That is, the sample directly enters the vial. It should not trickle along the body of the baby. It should not touch the hands. And while closing all the vial, also you have to see that your hands do not touch, or fingers do not touch the urine sample. So for proper collection of the urine sample, it is important that we keep few things handy, like a soap, a clean cotton wool pieces or wipes, and definitely a urine collection bottle. So before collecting the urine sample, it is important that the caregiver washes their hand thoroughly using soap and water. It is also important to clean the genital area of the baby, and while doing so, it is important that the foreskin is retracted in boys and the labia should be gently separated in girls. The method of the cleaning is cotton wool dipped in clean water is used. Occasionally, in some cases, the soap can also be used. In males, the area at the tip of the penis where the meatus or the opening is located is cleaned several times. In females, it is important that the cleaning is done in a direction that is anterior to posterior, not going all the way to the anus, because the anus is the area from where we pass stools, and this area is likely to be heavily contaminated with bacteria. So we clean from direction of anterior to posterior, stopping short of the anus, and we repeat the same action cleaning the vestibule at least 3 to 4 times. Now taking sample in a toilet trained baby who can pass on demand is pretty easy. But what do we do in patients less than 1 year of age who are not willing to pass urine, who do not pass urine on command? So there are few tricks that we can use. In babies who are less than 6 months of age, the mother can breastfeed the child approximately 30 minutes prior to sample collection so that the child is hydrated and is more likely to pass urine. The second thing that can be done is the lower part of the child's belly below the level of umbilicus can be gently massaged with a cotton dipped in cold water. This maneuver or this trick also stimulates the act of voiding, that is, passing of urine. So while these things are being done, the one person should be ready with the vial to collect the sample. As mentioned again previously, that the sample collection from the child's opening to the vial should be direct without any contamination or without any touching by hands or any other body part, and this is the way we can ensure to get the sample as clean as possible, which may help in proper interpretation of the results. Thank you. I hope after seeing this video you are more comfortable in collecting a urine sample.